Hi everyone, welcome to my first video on Trichotillomania Series, or maybe just body-focused repetitive behavior disorders. Yeah, my voice is funny because I caught a cold, so it's gonna sound weird. I'll add subtitles, don't worry about it. Anyway, I've decided to make a series where I'm just making my own artworks about my disorder and maybe just say a few things about it and talk about it. So my disorder has a very, very weird name. It's trichotillomania, and what that means is that it's a hair pulling disorder. So it's a disorder that is part of the body focused repetitive behavior disorders. It's a big umbrella term to define So as part of the Trichotillomania series, I am going to make a series of drawings or illustrations about how it feels for me to have my condition and what it looks like. I guess you could say it's a visualization of my internal struggle. So right now in this drawing, I am drawing a hand pulling hair from this person, and the person is unraveling, so their hair is disappearing. So in this drawing I was trying to show how it feels, one of the ways my condition makes me feel, and I feel like every time I pull my hair out I am losing parts of myself, like I'm literally disappearing, if that makes sense. A bit dramatic but not terrible. Sometimes it is tricky to have body-focused behavior disorder because sometimes you get used to it. Of course, I mean, it is a lifelong condition and you have to manage it, and after you have the condition for a few years, and I've had mine for 11 years, you get used to it, you manage it, it's just a part of yourself. Like it's not exactly an issue anymore, if you know, it's just another part of yourself that you need to take care of yourself. So there are some days that are easy, there are some days that I forget that I have this condition, and there are some days that are really, really, really difficult, and I feel desperate and frustrated and angry and sad. I feel very, very silly. So drawing really, really helped me cope with it. And that's one of the other reasons why I'm making this series of making artworks, not just drawings, just artworks in general about my condition, because it is cathartic and it helps me process what's going on, what's happening with me, but also it keeps my hands busy. So if I am drawing or sculpting or doing crafts, I am not pulling my hair. So it's a really nice way to physically and psychologically help me cope with my condition. So I'm going to be doing more of these in the future. So this is my first one, my first drawing debuting on my channel. Right now the drawing is quite simple. It's a plain white background with a subject in front of it in the foreground. I'm not sure if I should add more to this. The more I look at it, the more I think I should, but this is an issue that I have. I cannot ever do a simple composition. All my images and drawings are always very, very cluttered. Every inch is covered. There's always something somewhere. So I'm trying to unlearn that a bit and vary my visual style and try to put myself out of my comfort zone just for a little bit and see if I can create pieces on a plain background or just not as cluttered. Just trying to find a more balanced composition in my practice. Yeah, I figured I wanted to talk about my condition for a while, and not just trichotillomania, but also body-focused disorders. I wasn't sure how to do it. I was thinking about a few options, like podcasts, or a radio station, writing, and then or simply filming myself talking about it. But I'm not very comfortable in front of a camera, and I thought, you know what, I really like drawing. It is a really good strategy for me to deal with my condition, and I much rather show the process of drawing and the process of me creating instead of showing my face. That's when I realized, well, why not film the process of drawing and also talk about my condition? So 2 birds with 1 stone. I don't have to be in front of a camera, and you get to see something more interesting besides my face talking at you. Nothing wrong with it. I have no issues with watching videos of people talking at the camera. I mean, that's one of my main hobbies. But personally, I just didn't want my content to be about that, because the theme is quite heavy, you know, these mental disorders and how they affect me and people like me and coping strategies. So I wanted to make it a bit lighter, if you will. At least this way you get to look at something more interesting rather than just my face. You can see the process of me drawing and also hear a bit about the conditions and how to manage them and recent medical discoveries about them. And yeah, we have 12 or disorders. So these disorders, they exist in 2 categories. You either take parts of yourself or you eat parts of yourself. So for example, if it's dermatillomania, it means to remove parts of your skin. You know, so you pick at your skin and you remove just areas of your skin, just layers anywhere on your body. But if it's dermatillophagia, that means you are eating the pieces of skin that you're removing from your body. The disorder is onychophagia, which is nail biting, but again, it's not just nail biting, it's eating the nails you bite. The other one is mursicatio buccarum, which is biting the inside of your mouth, the cheeks around your teeth. Mursicatio labiorum, which means removing parts of your skin inside of your lips, specifically just focusing on your lips. There's of course mursicatio linguarum, which is to remove and bite away parts of your tongue. Onychotillomania, which is picking and pulling at your fingernails. So onychophagia is eating part of your nails, but onychotillomania is to remove. Trichotillomania, which is to pick at the nose and remove parts of the skin inside the nose. Trichotillomania, which is the one I have, which is to remove pulling your hair out, removing parts of your hair out. Trichophagia, which is to consume your hair. Trichotillomania, which is to cut the hair out. So some people compulsively shave or pick at the hair with tweezers instead of using their hands. There's Trichotillomania, which is to chew the hair out of your body. So normally with trichotillophagia, you pull the hair out with your hands and then consume it. But when it comes to Trichotillomania, you literally pull the hair out with your mouth. Like I said, these conditions have different causes. Everyone is different. It's always a case-by-case scenario, so you can't really compare a person with another. Why is it that someone has the same condition as you when they have completely different backgrounds and life experiences? That's just the way it is when it comes to illnesses, especially mental conditions. There are, however, overlaps in the causes of these conditions. So when it comes to body-focused repetitive behavior disorders, they are an umbrella term that defines the 12 disorders that I've just spoken about. And they are a coping mechanism mainly, meaning that when someone is under very high stress and anxiety, they will do one or several of these, or a combination of these conditions to suit themselves. So it's a suiting mechanism. So what is mostly confusing about them is that there are many, many different causes for these conditions. There's no such thing as only one cause, and of course it's a case-by-case scenario. Everyone is different, everyone is unique. So far, what we do know due to studies, medical studies, is that these disorders develop during our preteens, prepubescence, especially when we're just starting puberty. And the reason why, it's because there's this massive hormonal imbalance that starts when you begin puberty, and it triggers the condition. So it's not necessarily the cause, but it is a big trigger of developing these conditions. So some of the causes are, but not limited to, trauma or childhood trauma. It could be a hormonal imbalance. So for example, for some pregnant women, they develop a body-focused disorder during their pregnancy, and then after they have their child, they no longer have it. This is because their hormones are balanced. But again, for other people, it has nothing to do with their hormones. It could also be passed down by genetics. There has been, in many recent studies, the correlation between family members that have these conditions, family members who have never been exposed to someone who openly talked about their conditions. So these are people who didn't know they had family members that had these conditions. So it wasn't due to observation or exposure, but there seems that there is a genetic component when it comes to body-focused behaviors. Another potential cause of body-focused disorder is that the body-focused disorder is a side effect of a pre-existing mental condition. So there are many, many patients that have autism or OCD that also have a body-focused disorder, and the body-focused disorder is a side effect of the pre-existing mental condition. But like I mentioned before, there are different causes for these disorders. There are people like myself who have no mental illnesses, and yet I still developed a body-focused disorder. Another cause is side effect of medication. So there are some medications that will trigger a body-focused disorder, like trichotillomania. I will have to make a separate video just on that, on medications that are a trigger for this condition, and also medications that people with these conditions are using to reduce the condition, to reduce the hair pulling, for example. Another side effect is strep infections during childhood. So there seems to be that not just during childhood, but it seems that infections, specifically strep infections, could be a cause of body focus disorder. You know, any infection that happens to cross the blood-brain barrier is a main cause and or trigger for body focus disorder. This is actually fascinating to me. I just found out last month that any infection that crosses the blood to brain barrier, can cause trichotillomania, because I've had those strep infections. I've had several infections growing up, some that I didn't know I had, that I was suffering from for years, and there are so many other people like me that also had the same infections that I've had, mainly in the intestines. So it was fascinating to me that there's this main cause that I wasn't aware of. Another cause is observed behavior. So although I did mention that there is a genetic component, so there are people who, when they have this condition, they have it as a genetic component, but there are also children who develop it purely based on observation. There are children that are developing trichotillomania and other body focus disorders simply by observing adults who have these conditions and are pulling their hair for extended periods of time in front of the child, which is perfectly normal. After all, humans are social beings, and it's part of our evolutionary trait to observe and absorb the world around us so that we learn how to be the world. So children imitate all behaviors and language that they witness, especially if they've been exposed to it for extended periods of time. It does not mean that as an adult that you are failing if you realize that children around you are imitating your behavior when you have a disorder, because it is a disorder. Which leads me to the main point of this video, which is to say that body focus disorders are disorders. They are not bad habits, unlike what many people like to believe, people who do not have these conditions and don't struggle with them. Yes, there's still an inherent bias in society when it comes to mental conditions and unusual behaviors. There isn't exactly a known cure yet. There are many treatments. It is a mental condition that requires management, and it is possible to manage the condition and reduce its side effects. It does take a lot of effort, a lot of willpower, and patience with yourself. You need to understand that if you do have one of these disorders, it is a condition, you can't help it. It's not something that you can choose to have, it just happens. But there is a light at the end of the tunnel. It is possible to manage it and reduce it, and you just kind of have to cope with it, ironically. There are different levels of severity when it comes to these conditions. And I'm going to use myself as an example, but this is true for everyone that has these conditions. So, for example, I can go 2 years. I think the longest I've gone without pulling hair was 2 years and a half. Not only I wasn't pulling hair, but I didn't feel the need to, which is very important. Normally when we have these conditions, several of them or one or a combination of them, it is an impulse. You cannot help it. It feels like it's beyond yourself. But for those 2 years and a half, I was not pulling hair and I didn't feel like it either, so that was lovely. And then of course I had a relapse and it came back, and then I started pulling again. And that's perfectly normal, that's typical, that's part of these conditions, that they come up in waves. So that you will have periods of time where you are compulsively doing it intensely, maybe for a few weeks, and then you only do it once or twice a month. Maybe you stop, maybe you don't. Everyone's different. Some people do stop compulsively doing their condition for a while and then come back to it. Some people never stop. They just have reductions in their compulsive behavior, but it never fully stops. That's all part of the condition. That's just how it is. So the light in this video is not best because I was using natural light, and natural light changes very drastically throughout the day. I tried my best to even out the light in the editing, but even then there are many moments where the light fluctuates, and there are moments where the camera isn't exactly focusing as it should. It changes the focus from time to time. I will try to fix that in future videos. I will try to use artificial light from now on as much as possible so that you can have an even visual. And this is how the drawing looks finished. Well, finished for now. I am going to make changes. I'm not happy with certain aspects of it, I'm pretty sure I can do a lot better. It looks a bit strange in this image. So yeah, I'm going to change my drawing as much as I can in the future. Yeah, I will make changes to this drawing. I will show you in the next video how different it looks. I don't mind the plain background, I have to say. It's striking to just have this image in the foreground, but there's still a part of me that is saying that I really should add something more to it. So I'm going to fight against that urge and just leave it as it is, leave the background as it is, but I will, however, be making changes to the drawings I've already done. So this is it for my first video. There isn't a lot of in-depth information about body-focused disorders in this one. This is just an introduction to my series and what I'm going to be talking about. In each video I'll try to address a specific disorder, and I'll do my best to address more specific aspects of how to manage the conditions, coping mechanisms, and also resources that you can have access to so you can educate yourself more on the matter. Thank you so much for watching and have a lovely day.